Good morning. Today I want to talk about a story that happens in my office, and I thought that it's a very good idea for sharing this matter with you, and make sure that you as a patient, all of us as a patient, we have to be self-advocate. It's very, very important for us, every single one of us, to be aware of our body and make sure that if our doctor, they don't pay attention to it, we do pay attention. We make sure that we will bring it to their attention and ask questions. So one of the biggest um, advantage of going to dentists actually is that they say that the mouth or oral cavity is the mirror of your health, meaning that a lot of medical issues can be, there's a hint of something in your mouth that your dentist can report it to you, and you can do more investigation through your doctors by doing blood tests or other examination or tests that your physician would recommend. One of the examples is, leukemia is something that can be diagnosed actually by a dentist when they see that you have like some bleeding gum. When you sleep at night, you wake up in the morning and you have blood on your pillow. It could be gum disease, but in some advanced cases, God forbid, could be a medical issue behind it. So these are stuff that you need to discuss it with your dentist and let the dentist inform you or guide you how to talk to your physician about it. What also I think is very important for everybody to know is that oral cancer screening is one big point for you when you go to see your dentist every 3 months. You want to make sure that if once they do the screening, you ask them, do you see anything new? Or if you see anything in your mouth, don't just let go. I mean, if you see there is a black mark somewhere in your mouth, if you see that you have an ulcer in your mouth that is not healing, like the mouth heals very, very fast. So if you have you have a tongue ulcer that has been there for 2 weeks, 3 weeks, a month, or 2 or 3, and it doesn't heal, that's not a good sign. You need to make sure that you ask your dentist, how come I have an ulcer that doesn't heal? Any aphthous ulcer or anything like that, if you burn your mouth, if you have pizza burn, anything like that should heal within one week or so. So if you see something is existing in your mouth for like a few months, that's not a good sign. You want to talk to your dentist. You want to ask them to address it, maybe a biopsy or anything that could possibly help. So I had a patient last week that reported to me that he was a new patient for me, and his concern was that I have like all of my teeth are broken and chipped here and there, and no dentist fix it. All I go every 6 months to my dentist, and they see that I have this problem and they don't do anything about it. So we were talking, and he reported to me that he has a history of nasal cancer, some sort of oral nasal cancer that he received treatment about it about 5 years ago, and he had radiation and chemotherapy, and everything is fine since then. And no problem. He sees his physician, and there's absolutely no problem since then, and everything is great. However, when I started to examine him, I noticed that there is a black mark on his cheek inside the mouth. The first question I ask is, how long you have this? It's like, oh, I have this for 2 years. And I'm like, what have you done about it? Well, I keep asking my dentist, and they said, well, everything is okay, don't worry about it. Unfortunately, everything is not okay, especially for a patient who has some sort of oral cancer in the history. You have to, as a dentist, you have to be very aggressive toward biopsy. You need to biopsy right away. Unfortunately, and my point is, like, the patient was asking about this problem from his dentist over and over, but unfortunately it was not addressed properly. That black lesion could have been amalgam tattoo, because he had like some amalgam and crowns in that area, but it wasn't. Unfortunately, it was a melanoma, which after the biopsy we realized that it's another sort of cancer. and it was in his mouth for 2 years, and he knew about it, and his dentist was seeing it over and over. Well, this is something that you as a patient need to be your own advocate. You need to make sure that if you ask a dentist and like, it is okay, don't worry about it, maybe you need to get a second opinion. Maybe you want to ask them to do a biopsy. It's a very safe procedure. Let the pathologist look under the microscope and make sure that yes, it's nothing important, but do not just take it as granted that everything is okay. So that's my recommendation for today. Is very, very important. Please, when you go to your dentist, ask your dentist to check your mouth properly. If you yourself, well, it's a very good idea, maybe once every month or so, after you floss and brush your teeth, look in the mirror, check your tongue, check your palate, say ah, look in the mirror, say ah, and make sure in the back of your throat you don't see anything unusual. Make sure there's no unhealed ulcers in your mouth. It's very, very important. You see people that they have an ulcer on their tongue for months, that they're like, oh, I don't know why it doesn't heal. That's not a good reason. That's not a good sign. Please, please pay attention when your body tries to talk to you. Thank you.